Thank you everyone for meeting with us tonight. I am going to present on my interview I did with Miami and Erie Family Practice and Pediatrics. I met with Joyce, who was the practice manager. Miami Erie Family Practice and Pediatrics is part of the Joint Township District Memorial Hospital, which is a health system in St. Mary's, Ohio. MEFP is located in Minster, Ohio, and they currently have 3 family practice physicians. And Joyce is the practice manager for that group. But within the Munster location, they also have OBGYN, pain management, occupational health, a full-service laboratory, and radiology. Joyce is responsible for the day-to-day operations of the family practice for the physician group and is the on-site manager for the satellite departments. She's not directly responsible for the staff of the satellite services, but she would be the on-site manager available for any questions or issues that would arise through the day. She has 11 direct report staff that she manages to support the physicians. Joyce creates the staff schedules, human resource functions, hiring, evaluation, disciplinary and timekeeping, revenue cycle management, along with budgeting, policy and procedure writing and implementation, and addressing any patient satisfaction issues that would arise. This is a flow chart of the Grand Lake Health System or Joint Township District Memorial Hospital. And at the top you can see they have the board of directors, then it goes down to the CEO, and below that is the executive director, and you can see where I have a small red arrow, and that would be Miami Erie Family Practice and Pediatrics. The current strategic plan for the practice is that they want to be able to break even for their net 1 expenses. For the office, they want to start a patient navigator, and they are also recognized by NCQA for a patient-centered medical home. They're currently a level 2, and they want to be a level 3 by 2017. This is the current strategic plan for the office. When completing my SWOT analysis for the opportunities and threats, the opportunities that I could see was they needed to increase profits, all providers at a full patient empanelment, offering higher reimbursement services to help get to that profitability by adding the preventative care visits for patients and increasing the disease management. They have an opportunity for vitamin sales within the office, so doing direct sales. They need to promote and market all the services that are within the building. With that conversation with Joyce, she did point out that their occupational health provider is not at maximum. So there's a lot of opportunity there for patients to be seen. A definite threat within the area, since it is a small community, is if those competitions of another hospital would come into the area, that could definitely decrease the volume. On the SWOT, the additional strengths or weaknesses. Strengths, it's a one-stop shop. They have great patient access. They are patient-centered medical home designation. They have strong IT support back from the hospital. With that backing from the hospital, there are a lot of good policies and procedures that are in place, and they have the HR support. A weakness in the area is definitely the marketing. They need to get that message out of what they have to offer in that Minster location. But with that, they are getting ready to implement a new hospital-wide EMR. So that marketing, they've really crunched down on that, so they're not allowing them to do as much marketing. I went through here and completed the strategic factors analysis summary, and going through, I have red stars next to the things that came up the highest. So providers to a full panel, visit types, vitamin sales, marketing on services, competition in the area, a one-stop shop, patient access, hospital support, and marketing. Just out into the area was that definite weakness. So the strategic alternatives that I had come up with is getting the providers to a full panel, which does align with their strategic of meeting that break even. By doing this, we want to increase those different visit types and then education to the patient on those preventative services that are available. We want to increase the marketing, and then the patient access. We want to retain that. That was definitely a strength of theirs, and it aligns with their patient-centered medical home goals that they had set up for 2017. So the implementation for the full patient panel is the morning front office. They would do a huddle and then actually go through that schedule and see what appointments are available for the day. So they are meeting and they are designating where we have availability so we can get these patients in the door. At the end of the day, we want to be able to review what slots didn't get filled, and then how could we have increased those patient visits. We want to have discussion around the opportunities to get the patients added into the day. I think right now they have that perception of let's schedule the patients out. There's a little bit of the front office maybe blocking that. We want to get done and get out early. This way, if we're monitoring that, we're getting those patients in, and then we're definitely going to increase our visits. Implementation for the marketing. Joyce needs to get together with the department heads that are currently in her building, and then she would be able to come up with a piece to get out into the community. I mean, the best thing we want to be able to see them do is be able to align with a marketing company, but I know with that tight budget, they're not really going to allow that. The different departments have marketing pieces, so if they can use those pieces that are in place and get that out to the public within the first quarter of 2016, that way they're getting their message out, and then hopefully they can see a 5% patient increase by third quarter 2016. And then this will be reported back to the executive director to report back to the CEO and share with the board that building is becoming more profitable through this marketing that was spent. Patient access, front office, and this was definitely an area where it was a strength. So we want to keep that a strength. The front office to put the appointment blocks in the schedule so that they are retaining anywhere from 8 to 10 frozen slots in a day's time that will lift, so they are always retaining that access. Data can be pulled by the front office of any unfilled blocked slots, so they are monitoring and they are either shifting up or lowering down during those high flu seasons. So if we need more block slots because patients are calling in because they're sick in the morning, that they're able to adjust their schedule and identify where we're not meeting that need for the patient access. Evaluation and control. This is where I've come down to this so we can monitor it and really watch. The current performance on the full patient panel, the doctors are right around 73%. So the goal would be a 10% increase and get them up to 83%. Marketing, they're kind of looking at the same numbers because with the marketing, we want to increase the patients. So they're still at the 73% to do the 10% increase from the full patient panel, and then hopefully projecting a 5% increase by third quarter. And then patient access, I've went across the 3 doctors, and if we could freeze at least 8 slots a day for those providers, so we want to have 24 available slots within that office. So the goal would be to always maintain that we have, so if we have acute patients that will call in that day, that we can get in at least 24 of those patients and maintain that patient access. This is my presentation of Miami, Erie, and family practice and pediatrics. And can I answer any questions, please?
I don't have any questions.
I do. Oh, go ahead. Okay, my question is, as far as marketing goes, what would you say the best way to campaign that company would be?
I think definitely that one-stop shop, really getting out into the community, because the hospital is about 20 miles north and there's another hospital about 35 miles south. So getting into the community that they can offer pain management, that they can offer a full service lab and x-ray. I think their message needs to be that they can provide all the needs of the community in this one place and that patients don't have to leave the community to travel to get care.
Any questions?
Yes. Okay, sorry. My Mac was trying to update. But so you said that that your manager that you interviewed, that
Yeah.
she's over 11 employees. I'm just curious, what is the daily patient flow? Like, how many patients do
11 staff is full and part-time staff. So they don't have all 11 on site a day, and even one of the providers was part-time. So their patient volume ranges, the individual providers were seeing anywhere from 22 to 25 patients a day. So that support staff was also counting the front end staff that does the answering the phone, check in, check out, and then the back end rooming of the patients.
Okay, thank you.
You're welcome.
Hello everyone. My name is Nahid and I did my presentation on Ohio Health. As you all know, Ohio Health, it's a very big company established in 1981. It's not for profit organization, has 21,000 physician associate and volunteers. It also has more than 2 billion in net revenue, and it has 17 hospitals and 20 health surgery center. It's also one of the 10 healthcare system in the U.S. To be more specific, the healthcare organization I focus on, which is a center from Ohio Health. It's the Ohio Health location in the east side, Columbus. I mean, it's in Whitehall. The practice was built in 1996. It began to provide healthcare service to Whitehall community. It also include a rehab center, imaging service, laboratory service, mother's milk bank, and home care. I interviewed the supervisor at the imaging service, and they focus more on providing healthcare service to women. They provide mammogram to women age 40 and older, which is mammogram is the annual breast cancer screening. So the current situation at the practice, the mission statement for the company to provide the health of those we serve. The mission statement focus more on providing service to patients with more respect. The product and service the organization provide, it's MRI, CT scan, X-ray, ultrasound, and women imaging service, which I said earlier, mammogram screening. The organization also focus on serving those who don't have insurance. In 2013, they served more than $260 million. So they did screening to women who don't have insurance, and they end up collecting $260 million, which can benefit the community, and also $120 million to charity. This is the board of directors chart. The guy at the top, he is the CEO of the Ohio Health. I believe he's also the CEO of Nationwide Children's Hospital. As you can see, so they have the chairman following by the vice chairman, and then they have the treasurer, and then they have the secretary. On the sides, those are the board members. And those members there, as you can see, some of them are from a local business, some of them from American Electric Power, a lot of them are physicians, and some from West Ohio area and United Methodist Church. The variety of those members, they bring a lot of benefits to the organization by itself. They shape the hospital financial goal by providing a lot of feedback to the organization with a focus on financial operation. So they're very important to the organization. This is my strategic analysis. I don't know if you guys can see it, but I did give each strategic factors weight and ratings, and it came to 3.9. So the organization has a very high profitability. So my suggestion was comments about this. I believe they're making more money from operation, which could be they're providing more care to patients. So moving to the next slide, I have this strategic alternative. So looking at the weakness for the organization, I have found that there is like high staff turnover in the Whitehall location, and there is also poor communication between employees by themselves. So my strategy focused more on reducing the number of staff turnover and improving the communication between the employees in the practice. So the first strategy I came with, which is, as I said earlier, the mission statement for the practice is to provide service to patient. And the first strategy I created, which was focusing on high quality service to patients by hiring more talent patient registration employees. As I said, I focused more on the imaging center, and this center provides mammogram service to women. So I believe that hiring more talent patient registration front desk employees will help the practice to focus more on the high quality when providing service to patient. And the second strategy I came with, which was offering comprehensive strategy training with a flexible schedule to all employees at the location. One of the problems that the supervisor told me they have, it was the flexibility in schedule between employees. The practice has only about 17 associates, and sometimes it's just dealing with, time off, approving vacations. It could be a little bit harder because a lot of them, they don't really live in Whitehall area, so they require like about at least 30 or 45 minutes traveling time when there is like when there is like a lot of patients in the practice. And then the third strategy I came with was implementing new technology that can focus on improving communication between employees in the practice. They still the technology that they're using right now um, to communicate with each other is not really high technology. So I suggest that they should adapt more technology by June 2016. And this technology, it could be updating their software, for example, using 365, Microsoft Office 365, which you use here at Franklin, and it could allow employees to come together and to communicate. They could even join online section like what we're using right now. So I think this will help a lot in improving the communication in the practice. And the second strategy I came with, which was the staff turnover. I suggest that the practice should offer more internships and volunteers to the Whitehall community high school graduates by summer 2016, and maybe offer like part-time positions to those interns, and also make new opportunities and growth to employees for development and growth. This could be by giving feedback to the registration associates, and the feedback, it could be a bonus on performance or free tickets. Free tickets to to the zoo or to concert or anything like that. And this could all be done by the manager in the practice. And then the third objective I came with was provide more practice service in the practice, so they could add more radiology service which you can associate with women health to serve Whitehall population by August 2016. And then the second strategy was offer free classes to educate patients about the risk of breast cancer. As I said earlier, most of the patients who came to the practice are women aged 40 or older. So I suggest that the practice should offer free classes twice a week to just educate those women about their health, the women health, and the early signs of breast cancer and stuff like that. And then the third strategy was offer free annual mammogram to test to those who can't really afford the procedures by self. Um, and here are my reference. Does anyone have any question?
Do you think exiting interviews would help your staff turnover so that way upon exit they know what areas why they left the company and what areas they need to fix?
I think it will help a lot because most employees they leave their job not because they're looking for something better, but because they have a problem with their process. So I think having more interviews it will help a lot in reducing the staff turnover rate.
This is Amy. Just a real quick question I had when you talked about adding the women's health. I mean, were you mainly focusing on just adding the additional mammography?
No, I mean it could be anything has to associate with women health. I don't really like thought about specific examples of what type of tests they include, but I also like just think that if they include more service has to do with women health and specific with less money, it could be better and it could serve the patients. I mean more.
Very good.
Any questions?
And then I just have one question for you. I liked your idea about offering like the classes, the educational classes for women on women's health. But I'm just curious, since the classes are free, how will physicians be the ones like teaching the classes, and will they be on a volunteer basis, or will this be offered to just low income patients?
I mean, the teachers for those classes, they could be both from the staff, maybe, and from volunteers as well. I did volunteer at this location for a year, and what I have seen is like they don't really have a lot of volunteers in this location. So I think if they and if they tell volunteers who go to med school or who's made a lot of a lot of volunteers here at Ohio who they're majoring on ultrasound, those kind of stuff. So I think if they tell them about the idea of helping those patients and educating the women more about their health, I think they will be more interested in the idea by itself. So I believe it could be from both the staff and from volunteers as well.
Okay, thank you. One, I decided to do my strategic audit simulation on the James Care East. All right. The James Care East is an outpatient clinic that is located within OSU East Medical Center on the east side. The clinic is split up into 2 units. The first unit is on the 13th floor, is the exam unit, and the second unit is on the 14th floor, which offers chemotherapy. The clinic as a whole offers exam visits, chemotherapy, infusions, blood transfusions, injections. The unit's mission is to promote a culture of compassion, responsibility, accountable leadership that encompasses a care of self, coworkers, patients, and their families as patients allow the staff to join them in their journey. All right. There are a few external factors that affect the James Care East. If you look at the bar graph, you will notice that the biggest factors are the lack of insurance, the low socioeconomic status, and the increased number of patients that require financial assistance in the surrounding area. 31.8% of the surrounding population consists of low-income families. The James Care East is essentially made up of a series of board members, the director, the assistant director, the chief nursing officer, and the nurse manager. The staff generally does not have any contact with any of the board members or the directors. They tend to stay at the larger James Care facility, but the nurse manager is always on site for any issues that the staff may need or may have. And the chief nursing officer and the assistant director, they do conduct monthly to bi-monthly visits depending on the need of the clinic. And this is my SWOT analysis of the strategic factors at the James Care East. So as far as the internal strengths, it is the technology, the corporate structure, and the convenient location. The internal weaknesses are the fluctuating patient volume and the lack of better financial aid for patients. The external opportunities I found was that they needed to acquire a better relationship with the larger James Care facility. They need to reach out to a potentially untouched market within the local community. And they also need to offer alternative methods of treatment through research. The external threats are the fragility of the economy, the affordability of healthcare, and the surrounding community's poor socioeconomic status. All right, and this is my SFAS matrix. I don't know if you guys can see it that well, but pretty much the main factors that I found, the main issues was the fluctuating patient volume and the lack of financial aid for patients. This is due a lot of times to patients being uninsured, even though health insurance is now mandated, or they are either underinsured. This is usually due to limited outside funding, and also the area that the hospital is in has a higher poverty rate. So after looking at all of the factors, I have come up with these strategic alternatives. We should reach out to potential patients within the local community. This right here, it will increase patient volume, and this will help address the possible fluctuating patient volume that they see on the day-to-day basis. They could also acquire more patient financial aid programs in order to make treatment more affordable for patients. Now, they do currently offer one program, which is through a financial application called the HCAP. But the issue is that not many patients are eligible for this because it is very strict guidelines. And they also need to incorporate more research nurses. So this will give patients alternative methods for treatment that they didn't think existed before. And it also gives them a chance to take control of their treatment as well. So this is just a chart of the implementation, and I apologize if you guys can't read it. But the first thing I wanted to concentrate on was reaching out to potential patients within the community. A lot of people do not know that James Care East is even located in OSU East because OSU East is primarily an inpatient hospital. So the strategy that I think that can be used to achieve this is to increase advertising. The James Care East is small, so I guess the advertising could be a bit pricey, so that is one of the cons. But I believe they can make that up with bringing in more patients. The second is help patients acquire more financial aid methods and programs. So I think by adding additional financial counselors and by properly training staff of the new protocol and also adding social workers, we may be able to look into more financial aid programs and more opportunities for patients to be able to afford their chemotherapy and other doctor visits. Also, the last thing is to incorporate more research nurses. Like I said, hiring these nurses, they will give patients, like, again, a chance to be offered treatments that were not available. And this will be the only strategy actually that will be implemented on both units. The other two strategies do only need to be implemented on the 13th floor, Tower 13 exam. And this is just the target measurements and indications of positive performance of the current and future performances measured over the next 6 months. And again, I apologize if you can't read it, but the first one is the increased patient volume. Right now, currently, on average, the patients that the James Care East sees on Tower 13, which is a 13th floor exam, they see 40 patients a day. So ideally, within the next 6 months, after the goal has been implemented, we would like to at least increase that to at least 60 patients per day on average. We will also like to look into more financial aid eligibility. Currently, we only have on average about 5 patients per month that are eligible for financial assistance. When usually we have about maybe 15 to 20 patients that apply for financial assistance. So over the next 6 months, we would like to see that at least increase by a minimum of 10 patients per month. And also, we would like to see an increase of patients that are able to and would like to participate in research studies. We currently only have about 5 patients a month that are actively participating in research studies. So we would like to see at least an increase, at least double it to 10 patients per month. This right here, like I said, we would like to just educate them, and this right here will give the patients a chance to have different options. All right, so pretty much in conclusion, the James Care East is essentially a great facility for patients to receive care for their cancer. With changes in strategies that I have suggested, this clinic will be able to increase patient volume and reach out to the surrounding community. And they will also be able to offer more financial aid, so patients will be able to afford a lot of the treatments. So thank you guys for listening, and is there any questions?
I'm kind of curious, what kind of research studies are they doing right now?
Well, right now, it seems like the main focus of the research studies are on multiple myeloma, which is, I don't know if you guys are interested, or know anything about multiple myeloma, but it's a liquid tumor. So right now, that is like the main research study, and leukemia. So we would like to see it extended to maybe like breast cancer, lung cancer, and other cancers.
Thank you.
Do you know what type of education the research nurses they must have, or?
All of the research nurses, they have at least a minimum of a BSN.
Okay.
I believe.
Yolanda, the question I had on the financial counselors, I think that's an excellent idea of adding them. Do you think there would be the capability of doing some data mining and identifying those patients coming in ahead of time that are coming back for chemotherapy that we've identified with the high deductible, to potentially get that conversation rolling with them right away of there is additional financial assistance? Sometimes that issue is just they just won't apply. They think it's for the person with no insurance, so they don't apply. Do you think there's some data mining that could be done to help these patients?
Well, actually, I actually work at James Care East Registration, and I actually do the financial applications. And so generally, since we have a electronic system called iHits, we check into patients and we do their electronic charting. When we see, like, the first thing we notice is if a patient does not have insurance, of course, it automatically flags to the financial counselor to offer them assistance. Now, with the plan, I was thinking was that at the start, when we send out new patient packets, let patients know that that is available, because you are right. A lot of patients, they do think that it's for people that are completely in poverty and with no insurance. So, but yeah, we can believe if you go into our computer system, it does, it's able to track, and it does tell you if patients are behind on billing and everything.
Excellent. Thank you.
Herman, and I completed my strategic audit simulation project on the Laurels of Defiance. I currently work there as a physical therapist assistant, and the person that I interviewed was my boss, who is also the director of therapy. Her name is Renee Backrath. She is also an OTR, and she treats, and she also is the director. She's been there for 10 years. Okay, so I'll tell you a little bit about the Laurels of Defiance. It's a skilled nursing facility. It has 107 beds. About 50% of the patients are long-term and 50% short-term. And what I mean by long-term and long-term live there for, I guess, long-term. And then short-term patients are there to receive skilled therapy in order to go back home. The services that are available are skilled nursing and skilled therapy. And our main goal is to get you back on your feet and get you back home. The mission statement of the Laurels of Defiance is creating a legacy by exceeding the needs and expectations of those we serve while embracing the Laurel way. A little more, the Laurels of Defiance is just part of the Laurels network, which is scattered across 5 different states. And they mainly consist of skilled nursing facilities, and then they also have some assisted living facilities as well. Okay, we're going to go ahead and get started. As far as Laurels goes, the internal strengths of the company are that we have a strong therapy department. We have one of the best therapy departments in the region, and we have the best rate of returning patients back to home. We have a strong management department, a steady increase in profit, especially since we are the best in region. And right there you go, we have been voted best in the region for the past 7 years. As far as the external strengths go, we have strong communication with healthcare professionals that are working outside of the facility. We work strongly with 2 hospitals that are also located in Defiance, and we continuously are speaking with them. And we are also very good at continuously updating the care that we provide in documentation, and then, of course, our technology. We are always trying to meet the needs of insurance companies and payer sources to ensure that we continue to receive proper reimbursement. The internal weaknesses of the company is that we right now have a high turnover rate, specifically in nursing, but also in other different areas. We have poor communication, and it can definitely be seen amongst nursing and between nursing and therapy. And we also have an inadequate amount of computers, and this is causing employees to work either off the clock or go into overtime, which is bad for the facility because we're wasting money there. The external weaknesses are we are having difficulty utilizing ICD-10 codes. ICD-10 codes are the new billing codes. I'm sure you are all aware of that. That was implemented on October 1st of this year. Another thing is that we have inadequate usage of standardized testing in therapy. Payer sources are now looking more for standardized testing, in other words, like balance tests and things that we complete with our patients that gives them a number to see how that number increases over time, so that if the number stops increasing or if the number is so high, they will stop covering that patient. Okay, something that I want to pull out of this key, out of the ICD key facts, is that when we went from ICD-9 to ICD-10, we went from 14,000 codes to 68,000 codes. And so there's a lot more detail in these codes that we have now, and people are having a lot of difficulty picking which codes that they should utilize. these are just a few types of standardized testing that therapists complete, and a lot of them are balance tests and based on how the patient does with different functional mobilities like walking, or completing daily tests like cooking or taking care of themselves, bathing. Some internal opportunities, definitely to purchase additional computers. I want to create, in order to improve communication, I want to create steps and guidelines, create a small little board consisting of the director of nursing and the director of rehab, and have them come with steps that we have to take in order to improve communication. And then in order to improve the turnover rate, definitely complete exit interviews, because a lot of people are leaving for different reasons, and a lot is to do with the management or to do with the company itself. External opportunities to improve would be to send the employees to courses on ICD-10 so that they know how to utilize it properly, to make standardized testing mandatory for therapy, at least do 2 different standardized tests for each patient, so that way payer sources are seeing how the patient is improving. Again, with my threats, it's going to be about the same as what the weaknesses were, because they are a threat to the company. There's the high turnover rate, the poor communication, the inadequate amount of computers. Externally, all of this has to do with proper reimbursement, basically. Difficulty with ICD-10 codes and inadequate usage of standardized testing. Now I'm going to talk a little bit about the implementation of what I think will help. Purchasing the additional computers would consist of having the nursing and therapy department talking with one another on how many computers they need, finding a computer that will meet the needs of what we do need and is an adequate price, and then bringing it forward to the head director, Steve, who would then approve of this. And then as far as creating steps and guidelines go, a good way that I spoke with my boss would be to improve communication would be to, if we see an adverse sign or reaction with a patient, we have to take it to that patient's hall nurse, and we have to explain what's going on with the patient. They have to write a little note in their notes saying that we delivered that communication to them, and then they sign off. And same for them. If they come and speak to us about a patient, we have to write it down and we have to cite it ourselves. We've had difficulties in the past where there has been an adverse reaction down in the therapy room where a patient had shortness of breath extremely. We could not get him above 90%, and nursing did not react. The patient eventually ended up having a heart attack because he was not getting enough enough oxygen, and ended up dying on down the road. There's just many things that can happen. And then of course completing exit interviews, and then when the exit interviews are completed, that person would be the director of human resources. They would then take the issues up to whoever. Say there was an issue with the director of nursing, they would take that forward and tell that director that they need to improve in this area, and the director would sign off on it. Implementation continued for the external issues. I would have the employees who deal with the ICD-10 codes sent to a course in order to learn how to properly use ICD-10. I would also hire an individual to look over the codes to ensure that they are correct, and that in order to get proper reimbursement. Make standardized testing mandatory for therapists, like I said earlier. Have each therapist do at least 2 standardized tests with each patient. Of course, that's back to reimbursement again. Here's my references. Does anybody have any questions?
Sarah, this is Amy. Do you feel like with the additional of the proper coding that it could potentially cover the cost of the computers and maybe the new computer system?
I feel feel like it would, because I've seen my PT going through like the list of the new billing codes, and she's been having issues with selecting the right one, and I feel that if it was the correct codes were being used, we would have better reimbursement, and that would cover the computers. Thank you.
Perfect. Thank you.
Just one question. Do you guys, because I know you say I have issues with the transition of the ICD-9 to ICD-10, does she have an idea of how much you guys missed as far as reimbursement? Like how much money you guys missed?
I do not have that number. No, I do not. I'm sorry.
Oh, no, that's fine. Thank you.
Where is your organization located?
We're located in Defiance, Ohio. It's up in the very northwest corner of Ohio. There's 4 states. We are right within there, or 4 states, 4 counties. We're way up here. I'm about 3 hours away from Columbus right now.
Okay, thank you.
You're welcome.